So this is what exactly happens in case of a flat foot. Whenever you put the weight on your foot, what happens is, because of the ligamentous laxity or because of the tendinous rupture that happens in case of a older age, in case of young age, because of the ligamentous laxity, when the ligaments cannot support, they are not able to support the respective bones. We have 26 bones in the foot. Now look at this picture, look at this video. What is happening? When you put the weight, the joints are opening up, the foot is diverting out, the heel is going out. So these are the changes which happens in the flat foot. Now, if there is one ligamentous laxity, what will happen when you, on such kind of a foot, if suppose your weight is very heavy, like you are overweight, your BMI is high, in that case what will happen? Because of the continuous thrust, ultimately the ligament will rupture and the foot will get fixed in this position where it will become rigid. So initially you will have a flexible flat foot, later on it will convert into a rigid type of flat foot when there will be a like slight dislocation. We should say slight subluxation, then ultimately there will be a dislocation of these joints, as there are multiple joints, because there are 26 bones and there are multiple joints in the foot. Every single joint has its own importance, so do not ignore your flat foot. Stay tuned for more videos. Thank you.
Hello everyone, and this video is the continuation of the last video of the flat foot. So to better understand this one, just go and watch the previous one. So what is happening over here, we'll compare with the last video where the foot bones were subluxating and the joints were opening up. There are multiple joints. Now look at this video carefully. What is happening? The same subluxation is happening, and simultaneously as you put the weight, your tendons are getting stretched and they are getting pushed, they are being traumatized. So in a way, there is an injury is happening to this tendons. We are not showing the ligaments over here. In the next video we'll show you the ligaments. So the tendons, they are undergoing degeneration, so they are getting damage to these tendons. So when people ask me, I'm having the flat foot since long when I was a kid, why I didn't have the problem at that time? Because this is a very slow and the gradual process, and you do not walk barefoot. You wear shoes, you wear slipper, they provide a kind of a cushion to your foot, so they kind of take care of your foot. But when there's a laxity in the ligaments, so in that case alone footwear and alone the shoes, they will not help you. They will help you up to a limit. So here the degeneration, if it is beyond the limits, then that needs a repair. So next video will show you more. Thank you.
Now regarding the types of flat foot, if you look at this bone, if it moves, okay, if it moves, try to hold this part. Now if you can see, if this bone moves, it means the flat foot is a flexible variety, and if this segment also moves, that means flat foot is a flexible variety. If these bones does not move, okay, then it is a rigid variety. Now in rigid variety, this thing does not work. In case of a rigid flat foot, these patients usually land up before the age of 20. So in that cases, what are the options do we have? We have a lot of options, but one thing I can assure you, the flat foot, these are correctable conditions. They should be corrected with time, so that you should not suffer any kind of a problem in the future. I mean to say, around the age of 30, around the age of 40, whenever you want to do the exercises, you want to lose weight, you want to do a lot of fitness related things, but you do those things with the help of your feet. If your feet are not good, they will not support you, then you cannot basically reach your goals. So to reach your goals, what you need to do, you need to get these things corrected. So what I want to say is, if your child is having a flat foot, get these things corrected with the help of these small things, but from a foot and ankle surgeon. Go to the expert. Okay, now the next thing, if the flat foot is a rigid variety, in those cases the surgeries are there, but they are more of extensive type surgeries. They need more of a rest. Like in this case of stent, within a 1 month, your patient, your kid, he or she will be very good, he'll be walking and everything. But in case of the rigid variety, it takes 3 months to get back to the track. So first of all, diagnosis should be made clear. Second thing, always go to the doctor and try to understand, okay, how these things helps. Try to understand that thing, okay, and how the extensive surgeries work, how these small surgeries work, what is the MIS, minimal invasive surgeries, what are these stenting. So just try to understand these things. Only after that go for the intervention. Okay, so this is all about the flat foot. If you are having any trouble, your kid, your son, your relative, anybody is having the flat foot issues, you can reach me out wherever, on the Instagram, on the Gmail. If you put my name, you will get all the details. You can reach me out, and I'm really literally accessible to everybody. So don't be hesitant. Okay, so you can ask me any questions over there. Just put me on the WhatsApp. I'll try to answer. Thank you.